So many times during the course of clinic, I've had patients who, were referred over from a doc, but they didn't have a lot of symptoms. And I actually studied if it was possible to influence compliance in patients who are asymptomatic. When the patient came in who had no symptoms, I figured that I achieved compliance if they purchased a product a second time, because they could have purchased it, never used it yet. So our success over the course of 6 months was if they repurchased. And what I did is I took a picture on TelScreen of the pathology, whether it was blepharitis collarettes, whether it was dry eye patches, whether it was inferior exposure keratitis, didn't matter. I'd make it big enough in the screen that they could see it. Sometimes larger images scare people more anyway, so that's good. I would then say, a phrase that I consider pretty magical. And, I'm seeing something here that concerns me. Patients get really worried when the doctor's concerned. It is a pretty amazing phrase. And patients do. They get kind of a little white. They lean forward. And then I explain, here's what you have. And if I don't treat it, here's the consequences. Eventually, you will get debilitating dry eye. You will lose these lashes. You will continue to have breakdown that's hard to fix. And we achieved more than 70% compliance. These were asymptomatic patients. But I'll tell you, without the TelScreen image, I don't think it's as effective, or even nearly, maybe even not effective at all, because until they can see a picture of their own eye and you explaining what you're concerned about, in an asymptomatic patient, they're not likely to believe necessarily what I'm explaining until I can show them their own eye.